open the room, Asmita.
Ma'am, you can start the session.
Good evening, everybody. I am Dr. Bindu Menon, the chair of the Indian Academy of Neurology Outreach Subsection, and welcome to this fourth webinar on Outreach Subsection of Neurology. As we all know, the WHO's Intersectoral Global Action Plan on Epilepsy and Other Neurological Disorders from 2022 to 2031 is marking a turning point and will represent a revolution in neurology. In this, the Neurology Revolution collaborators have highlighted that the WHO's IGAP is propelling neurology to the forefront of the global health and the developmental agenda by harmonizing global neurology activities and advocacy efforts into a unified, powerful voice. We are really fortunate today to have one of the pioneering person for this neurological revolution with us today, and he is going to outline us how things are moving forward and how things are starting to change in the neurological forefront across the globe. We have with us Dr. Mayowa Ojo Ovalabi. He's a director, Center for Genomic and Precision Medicine Center, College of Medicine, University of Ibadan. He's the pioneering regional vice president of Sub-Saharan Africa World Federation of Neurorehabilitation. He's a member Presidium World Federation of Neurorehabilitation, founder, co-chair African Stroke Organization, leader, co-chair WHO Stroke World Stroke Organization and the Lancet Neurology Commission on Stroke. He's a member WHO Technical Advisory Group on NCD Research and Innovation, member Board of Directors, World Stroke Organization and the World Hypertension League, Associate Editor of the Stroke Journal, Dean Faculty of Clinical Sciences, University of Ibadan, Honorary Consultant Neurologist, Department of Medicine, University College Hospital, Ibadan, Nigeria and West Africa, pioneer of WFNR Blossom Specialist Medical Center and the first center for neurorehabilitation in East, West and Central Africa. Professor Mayowa has got a huge writing as well. He's an eminent scholar and a stroke phenotyping software patent with more than 400 publications in peer-reviewed journals, which include The Lancet and Nature, with more than 135,000 citations and a Google Scholar Index of 87. He's a recognized global leader in medicine, neurology, cardiovascular health, neurorehabilitation, global health, brain health, Community-Based Genomic Epidemiology of Stroke in Africa, Clinical Trials and Implementation Science. We welcome Professor Ovalabi to our Indian Outreach Subsection webinar. And once again, a sincere thanks from the Indian Academy of Neurology and the Outreach Subsection and from all members. We look forward for your lecture. Welcome.
Yeah, thank you. Thank you very much. So let me just share my screen. Just give me 1 second. To share my screen, trying to look for the presentation. Okay. Yeah. Can you see my screen?
Yes, sir.
Excellent. Thank you very much for this opportunity to talk about brain health and the neurology quadrangle. So this is a publication in Nature Reviews Neurology last year, and it's about global synergistic actions to improve brain health for human development. Indeed, we need brain health for human development. I mean, human intelligence is extremely important. We are talking now about artificial intelligence, but human intelligence is what created artificial intelligence in the first place, because artificial means man-made. So human intelligence must be superior to artificial intelligence for humans to create artificial intelligence. So brain health is very important for human development, evolution, and growth. Why is that important? 1 in 3 people are at risk of a neurological disorder in their lifetime. And the neurological disorders, including stroke, particularly stroke, is the second leading cause of death globally. And in the last 3 decades, the number of deaths from neurological disorders have increased by more than 40%. So therefore, neurological conditions are like the fastest growing cause of death among NCDs. And stroke alone costs almost up to $1 trillion per annum, while dementia costs over $1 trillion per annum. Now, what are the top neurological conditions that are responsible for this burden? This is the top 37 from the GBD database. I'll just go through the top 10. Stroke, neonatal encephalopathy, otherwise known as cerebral palsy, migraine, dementia, diabetic neuropathy, meningitis, epilepsy, preterm birth, autism spectrum disorders, nervous system cancer. These are the top 10 across the globe, but there are regional variations, including in India, in Southeast Asia. But these are still the top 10. And in fact, I think in Southeast Asia, it's essentially those top 10. So the burden of these neurological conditions vary across age group or age strata. As you can see, neonatal encephalopathy tops the charts in the first year of life, thereabouts. Early neonatal, and then late neonatal is still really one of the main burdens. Then followed by meningitis, and middle age migraine, but then stroke takes over and increases until very late, and of course dementia, Alzheimer's and other dementias also take over. Now the burden of stroke has remained the same. I mean, in terms of ranking, still number 1 among all neurological conditions. Neonatal encephalopathy remains number 2 over time, but a few other things have changed, like dementia coming up and migraine coming up in rank. So this is a change in ranking. Again, as you can see, between 1990 to 2021, you see there is an increase in diabetic neuropathy, neonatal sepsis, cerebral malaria, and so on and so forth. And actually, indeed, the female to male ratio also changed for all neurological disorders. That's what that is showing. Now, in terms of stroke specifically, the absolute numbers for stroke in terms of the numbers, incidence increased by 70%, prevalence by 85%, and and deaths by 43% between 1990 and 2019. So there have been a lot of revolutions, mechanical, electrical, the different industrial revolutions, digital revolution, and all of that. But let us dare to say now there is a brain. Of course, there is artificial intelligence, which helps with planning, robotics, machine learning, and so on and so forth. Let's now usher in the neurology revolution. The world has in the past witnessed agricultural, industrial, and information revolutions. Here comes the neurologic revolution. So far, this is the only revolution that is really talking about man and not something outside man. This revolution will power all aspects of human well-being and welfare through brain health. And we have a publication in Lancet on that. So brain health is the complete functioning of the brain across the life course to support the full physical, mental, social, and spiritual well-being and quality of life of an individual towards attaining and maintaining the epitome of a meaningful, impactful, purposeful, and productive life. Brain health involves protection, promotion of brain function, and is important for total and spiritual well-being. And then there is also the concept of brain reserve and dementia. So it's not just about looking at diseases, but looking at actually how to promote and improve brain performance towards maintaining dementia and supermentia. So from dementia to supermentia, which is what we proposed. So, well, this has been mentioned by Dr. Bindu. The May 2022 launch of the Intersectoral Global Action Plan against epilepsy and other neurological disorders, and with the strategic objectives of raising policy prioritization and strengthening governance for neurological disorders, providing effective, timely, responsive diagnosis, treatment, and care, implementing strategies for promotion and prevention, fostering research and innovations, and strengthening the public health approach to epilepsy. So the Intersectoral Global Action Plan, involves vision of a world where the brain is valued, where brain health is valued, neurological disorders are prevented, diagnosed, treated, stigma is reduced, people-centered primary health care, and universal health care. So prioritization, diagnosis, promotion, research, innovation, public health approach with global targets. So when you look at this more closely, you will see that we will need, in terms of the IGAP benefits. The IGAP benefits includes gender equity, dealing with gender equity, reducing inequalities, reduce poverty, societal inclusion, engage citizenry, improving safety and security, resilience to global shocks, misinformation, and so on and so forth. So the IGAP implementation over 10 years, these are the core priorities, which I had mentioned previously, and the targets according to, and this is a publication in Lancet Public Health. So summarizing, we need to deal with these, all neurological disorders. We've mentioned the dominant ones. There are many of them. We need to deal with them within the continuum of care: promotion, prevention, diagnosis, treatment, rehabilitation. And while dealing with them, we also need to integrate into the care of NCDs generally, improving mental health, communicable diseases, as well as social determinants of disease, and deal with these across the life course through the health and social care system, including universal health coverage and primary health care, to reach everybody. So this is what is advocated richly, comprehensively in this publication. So brain health is central to human development. In fact, without brain health, there is no health. Without health, there is no wealth. So all the SDGs, no poverty, zero hunger, quality education, all of these SDGs, gender equality, all of these SDGs they depend on SDG 3, which depends on brain health. And brain health in itself influences physical and mental health, social health, and planetary health. And all of these also are influenced by spiritual well-being. So this is the multidimensionality of neurology and brain health beyond the health sector. How brain health interacts or is interdependent with other sectors, including political sector. For instance, in Norway, there is a brain health policy, brain and vascular health policy, which had reduced the burden of dementia of stroke by about 30% over 3 decades. So all of these have import. Food and agriculture, for instance, adequate and healthy diet is useful for promoting brain health. So addressing brain health determinants is very important to optimize brain health optimization or to optimize brain health and to improve health, social and economic benefits and enhance well-being. So when we are looking at brain health at the center, we should realize that there are many factors that influence: political factors, social factors, biomedical factors, psychological factors, economic factors, environmental factors. And therefore, we will need a whole of government approach as well as synergistic global movements, life course approach, holistic socio-ecological approach across the entire life course. So this is extremely important. Yes, we're talking about brain health, cognitive, emotional, behavioral strength plus absence of disorders. But this brain health is so important and central to brain capital. Now we talk about knowledge economy and a knowledge-driven economy. So for that and human capital, the most important part of human capital is brain capital. And the most important driver of knowledge economy is brain capital. So, and that consists of knowledge, creative skills, optimal brain health, which people accumulate over their life, and then enabling them to realize their potential as productive members of society, including brain skills, creativity, entrepreneurship, design thinking, and brain economy. So, but in the South, global South, you will see that spending on health and indeed on brain health is very lean. Same thing with research on health and brain health is very lean. So it's important to have a global ecosystem that engages all stakeholders and partners, providers, practitioners, physicians, policymakers, patients, payers, the general population, to be able to, along with implementation partners, to be able to implement brain health across the globe. And so it's important to have surveillance research. These are the 4 pillars of the brain, of the neurology quadrangle. Surveillance is very important because without surveillance, we will not know the burden of the diseases, the risk factors, and the health services that are supposed to be improved. And by surveillance, we will be able to monitor the impact of any intervention and plan those interventions and monitor their impact. The second pillar is prevention and promotion. Integrated population-wide strategies to reduce the modifiable risk factors, and this is usually through task share. This can be achieved through task sharing and digital technology, because that's how you can reach very large numbers of people, and of course also through the primary healthcare and universal health coverage systems. The third pillar is treatment and acute care. In stroke, most of the time, most people are focused on treatment and acute care, neglecting prevention, promotion, but this is extremely important. Prevention, promotion, surveillance, they are all very important. So treatment, providing effective, timely treatment, diagnosis and treatment for acute care services. And of course, the fourth pillar, which is rehabilitation. So all these 4 pillars interact, and there must be a core to aim at strengthening health systems and resources by workforce training and prioritization of neurological disorders. So these are the 4 pillars of the neurological quadrangle. And let me focus on neurorehabilitation because that's really important. Now, when a patient has a neurological problem or injury or disorder or condition, we start by assessing, setting goals, and then therapeutic intervention. This therapeutic intervention is usually multidisciplinary. Patient at the peak or at the center, Goals are co-created, and then caregivers, physicians are involved, and then you have an array of specialists that may be required. Speech and language therapies, psychotherapy, physiotherapies, cognitive rehabilitation, occupational therapy. The essence is to add years to life, but not just that, to add life to years, including making sure that there is brain health, for that individual to have brain capital and the brain economy to be able to perform and contribute, and adding meaning to life and self-realization and self-actualization. And this happens through neuroplasticity and adaptive psycho-spiritual model. So the WHO also has a package of interventions for rehabilitation, which include neurological disorders. Uh, the essence of rehabilitation, of course, is to improve quality of life and maximize the ability to live a productive and meaningful life, adding years to life, life to years, and meaning to life. So for this to happen, we need to build resilient health systems that provide accessible, affordable, effective rehabilitation. And it must be integrated into the national and subnational health priorities, strong multidisciplinary, contextually suitable rehabilitation workforce, and interdisciplinary care expanded to involve newer fields like medical humanities to offer holistic care. So spiritual sphere is important for internal adaptation and for coping strategies, and for the establishment of continuity of self along the path to recovery, self-discovery, and rediscovery, and self-rejuvenation, purpose in life, and self-determination. Now, let's talk about the different pillars and the challenges to implementing the neurology quadrangle for these uh, different pillars and the solutions to those. Let's start at the level of systems, health systems. For the surveillance pillar, there is inadequate prioritization of neurological disorders and brain health with limited funding and other infrastructure. Uh, that's for surveillance, because for you to do surveillance, you actually need resources to be able to, for proper diagnosis and databases to collate all these data and dashboards to display and utilize these data on the different neurological disorders. Most of what we have is from the global burden of disease, which relies on sometimes very scanty and unreliable data, and then or extrapolated data based on models rather than empirical data. So this needs to be improved across different countries. We know the power of data. I mean, that played out in the COVID-19 epidemic, whereby almost every day CNN and every news channel was flashing every new number, you know, of people who have caught the disease or who died from it. So if we have this kind of figure for stroke, that will really help to drive change and to drive improvement in care. So for prevention, there is high prevalence of unhealthy diets and other lifestyle factors, social determinants, commercial determinants, which are driving the burden of non-communicable diseases in our communities, including the burden of stroke and other neurological conditions like dementia. So this needs to be dealt with. Many times there is complete absence or inadequacy of or insufficient implementation of policies that promote healthy dietary and lifestyle choices. Then acute care. Unavailability of emergency services, for instance, acute and acute care for stroke. Not many people have access to this within 3 or 4 hours of having a stroke. Limited access to diagnosis and treatments in developing countries. How many people really have access to MRI if there is dementia, or brain CT if there is stroke, or neurophysiological studies if there is peripheral neuropathy? So this has to be dealt with alongside inadequate health insurance coverage, lack of referral systems. For rehabilitation, the issue is inadequate rehabilitation facilities and lack of trained therapists, which is actually the main issue. And this is across the globe, but worse in LMICs where they are needed most. And this is compounded by brain drain. Lack of awareness on the importance of meaningful involvement of patients and experiential knowledge. That's at the very core. And then possible solutions involve patients and advocacy groups. And I know Bindu Menon and Nyamasuya, many people are really doing a lot of this in India and across many LMICs. So advocacy is very important. Prioritize neurological disorders, develop local and national data collection strategies, like registries, perform effectiveness analysis for various treatment options, allocate budgets accordingly, use social media for advocacy and education, and also for prevention, leverage technology solutions, telemedicine to bridge gaps in access, develop, reorganize infrastructure, provide effective training for physicians, nurses, and other people, implement policies to promote healthy lifestyles, and to reduce the burden of non-communicable diseases and neurological conditions. So at the provider level, surveillance and research, poor awareness of the importance of surveillance at the provider level, or is overwhelming workload, and then they really are not able to provide data or feeding those data into databases that can be harnessed. For prevention, poor awareness of providers' role in health advocacy, or they have overwhelming workload. So people are really focusing on acute care, and they don't really talk about prevention and the community health. It's only those that come to the hospitals that are attended to, and that is it. Rather than looking at, and that's just the tip of the iceberg, rather than looking at the remaining body of the iceberg within the community. For every single person that comes to the hospital who has a stroke, there are dozens of those who are at risk, who are in the population, that can be targeted through prevention. Acute care, there is inadequate training, overwhelming workload, all of these play out. Inadequate numbers of trained personnel for rehabilitation, and then inadequate training, overwhelming workload for the core, and possible solutions: educate and train healthcare providers, leveraging technology and digital tools, decision support systems for acute care, improve local data collection and registries, improve awareness regarding their roles in prevention and telemedicine. Then at the level of the patient, poor awareness of the importance of health surveillance, for them to report diseases or present at hospitals within the orthodox system where they can be captured. Poor awareness of brain health and its implications for overall health, low health literacy, poor healthcare seeking behavior, poor awareness of risk factors and opportunities for risk factor modification. Cultural and social beliefs might cause delays in seeking healthcare. So we need to deal with it. That's in terms of acute care. Transportation issues, health insurance issues. Then cultural and social beliefs might hinder use of rehabilitation services. When people believe maybe nothing can be done again, or they think is a religious attack. So low health literacy, cultural beliefs, those are things that need to be dealt with even at the core. So improving brain health by promoting health education, using it from reliable sources, including social media, where appropriate, patient support groups, public figures with neurological conditions can be used to raise awareness and help with education and community engagement. So at the end, we want people to self-actualize and even achieve transcendence. So energy therapy may be important for rehabilitation. These are new areas that are coming up: spiritual psychotherapy, motivational psychotherapy, spiritual music therapy, motivational artwork. And this involves, working with musicologists, people in medical humanities. So neurology revolution is going to be powered by the biophysical wing and the psychospiritual wing. Neuro implants are coming on, artificial intelligence becoming important, human brain projects, planetary health, human affectome project, human connectome project, neurotechnologies, neurostimulation, brain computer interfaces, neurotransformics, multiomics, stem cell therapies on one hand, but on the other side, neurophilosophy, medical sociology, neuromusicology, literary arts, medical humanities, spiritual psychology are all helping. And within the umbrella of One Health, Brain Health, Holistic Health, Neurology Quadrangle, and Synergy, working with the WHO IGAP, with One Neurology Consortium, Rehabilitation 2030, and so on and so forth. And then, of course, using digital tools to reach out and to advocate, and working, co-designing and co-implementing ecosystems that involve all of government, interdisciplinary, multisectoral, and with all stakeholders. And the six P's, that's patients, the populace, providers, implementation partners, and the payers, those who pay for health services. So the seed of life model of precision health, public health, means if a patient comes to you, you want to be able to diagnose know what is responsible, treatment, prognosis, prevention, and follow-up, but across the entire axis of the human existence, the body, the mind, spirit, soul, the eco-social, the internal coherence, and external harmony. So interventions for promoting and restoring brain health uh, includes, global and disease-specific approaches for surveillance, research diagnosis, biomarkers, prognosis, prevention, treatment, rehabilitation, and restoration. Government and society approach, social economic and identify and dealing with social, economic, ecological, and political determinants. Global governance through extensive global movement of people, capital goods, all of these are happening. But the beneficial factors of global governance is that new medical treatment can spread across the globe and then deal with environmental contaminants and deleterious factors. So synergistic effort, all of government, all of society, quadruple helix, working with NGOs, working with public health systems, working with scientific communities and academia. So, for example, this is very complex. This is just an example. If you really want to improve stroke control, you must improve not only motivation through education, but also capability. Because if somebody wants to eat healthy diet and is not available, then he doesn't have the capability or the opportunity to do it. And so physical capabilities, psychological capability to implement the change is important. Motivation, both automatic, internal, as well as the reflexive motivation. Training is important. Incentivization, sometimes coercion through regulation, legislation. Guidelines are just only a little bit of part of the arc. Just just a little piece of the puzzle. There are so many other things that need to be dealt with. Communication, marketing, just the same way marketing is used to market unhealthy diets. We can also turn it around and use marketing to marketing strategies to market healthy lifestyle and healthy living. So legislation, service provision, regulation. So all of these are important for enablement, for modeling, for training, and to ensure that we are really able to improve brain health. So this is an example of a brain health or vascular health policy, which worked in Norway with 30% reduction in ischemic heart disease, 35.3% reduction in stroke over a few decades. So a lot of technologies are coming on. I mentioned some of them: neurorobotics, neurostimulation, neuroimplants, and they're working naturally after spinal cord injury through brain-spinal interface. AI is actually changing things, even though it will take some time before this becomes available at population level. Exoskeletal devices, the Human Connectome Project, neurotechnologies, which have been invested in bi-directional BCI, state-of-the-art BCIs, using augmented reality, virtual reality for rehabilitation, the Human Affectome Project, Human Brain Project, let me also understand better. Stem cell therapy, which is still being investigated, is experimental. But then spiritual psychology, which is very important, and medical humanities, neuromusicology, arts. These are all very important for brain recovery and for brain health. So essentially, for each individual, you want to establish the Ikigai, the intersection of passion with vocation, with mission, with profession, to enable that person achieve transcendence and live a good life that is meaningful, productive, and contributes to human development and evolution. So I will illustrate with what we did with stroke, the Lancet Commission on Stroke. I was lead co-chair. We operationalized these 4 pillars of the Lancet Commission. These 4 pillars of the stroke quadrangle, which is similar to the neurology quadrangle: surveillance, prevention, acute care, and rehabilitation. And with key messages for rehabilitation and for other aspects, which I'm not going to go into detail about. So the neurology revolution is there, and we need to turn science into holistic well-being. These are some of the programs we are doing in Africa: Talents Program, postgraduate course, GRASP, and some of the activities that we are doing here. So I want to once again thank the Indian Academy of Neurology for inviting me to give this talk ahead of the World Brain Health Day coming up shortly. Thank you so very much.
Thank you so much, Professor Maiva, for that wonderful and such an exhaustive way to look at brain health. It really looks like a Herculean task given the 10-year program still. There are a couple of questions there for you. When we are looking at all the diseases like stroke and the ones which we commonly encounter, ones in an outpatient physician does encounter like fibromyalgia, lumbar and cervical discs, which are which do not need surgeries. Are they also being considered under the disease umbrellas, or they have not been looked into?
Yeah, they're also being considered under spinal disorders. They're actually extremely common. That's the truth of the matter. I mean, cervical spondylosis with spondyloradiculopathy or spondylomyeloradiculopathy, lumbar spondylosis with spondylomyeloradiculopathy or spondyloradiculopathy. These are really very, very, very common as people age. Extremely common. So I'm not sure these were adequately captured in that GBD data, which is why we said we need to capture this information because they are much more common than is being presented from the GBD. I'm sure we see them very, very commonly. In fact, by the time people are over 50 or over 60, 1 out of every 2 will have some degree of lumbar or lumbar spondylosis or cervical spondylosis. And in fact, this also goes on to cause what is called cervical vertebral tetrad, which I proposed, something I proposed in 2006. It's a syndrome I proposed called cervical vertebral tetrad. If the osteophytes impinge on the vertebral arteries, they can cause dizziness because of rotational vertebral artery occlusion. When the person turns his head or her head, rotational vertebral artery occlusion, and if they have vascular risk factors, that makes it easier for that to happen. If there's already something in the lumen, they already have atherosclerosis from hypertension, dyslipidemia, or diabetes, and then there is spondylosis, and the osteophytes press on the vertebral artery when there is a neck rotation, that leads to vertigo. So it is very, very common. I think it's underrepresented or underreported, and that again emphasizes the value of surveillance. Thank you very much.
Yes, absolutely. What you said is this diseases and fibromyalgia complaints are very commonly encountered by neurologists, probably are underrepresented in the GBDs. The question is that this is such a vast work in front of us of all neurologists. What would you think is the most effective public health initiative which is currently in place to promote the brain health on a population level?
Thank you very much. I think what we tried to do in Africa, for instance, was the WHO put a team together, which I headed, to do what is called domestication of the WHO Intersectoral Global Action Plan, to really come up with a statement on what government can do. That's at the policy level. But what we can do, I think the key to answering this question really, or solving the problem, is prevention. Of all the 4 pillars, I think the most important is prevention. And to deal with that is advocacy and then population-wide activity. Through, we can provide, for instance, stroke can be prevented 60 to 80%, can be prevented. Of 60 to 80% of stroke can be prevented if hypertension itself is prevented, or if hypertension, diabetes, dyslipidemia, and the other risk factors are identified on time. And then if there is healthy diet and exercise across the life course, many of these diseases can be dealt with or prevented. So I think prevention is the plank, is the main pillar of this activity. And we can use social media. I mean, we can develop videos that people can use, can educate people. We can also use films, the film industry. And India is very good with film industry, and not, and you know, Bollywood is, India is very, very popular. So I mean, the film industry is very powerful for behavioral change because people get educated, they see how things play out over time, they can gauge the consequences of their actions or inactions, and that can cause spark behavioral change. So it's about communication, to the largest number of people in the language that they like, to encourage them to for behavioral. And it's all of society approach because okay, if somebody knows he wants to eat healthy diet, and that is not there. So the agricultural sector, the food industry, the food value chain, they have to be incentivized to provide healthy food, and there should be taxation or penalties for unhealthy practices. And this taxation can then be rewired or rerouted and used for brain health to promote brain health.
Thank you so much, Professor Maya. But this is really great. But in India, the population is so huge and it's so vast. I wonder that with this IGAP in place, what metric can be used to assess the progress and impact which is there in the field of brain health? Do you think it is really possible in the next 10 years that we would be able to access that? Yes, there has been a measurable change.
Yeah, I think it should be possible. It should be possible. So I think what we need to do, of course, is take each of the major diseases and see whether their incidence, their prevalence, and DALYs accruing from them is declining or not. Then look at the burden of the risk factors. Let's see, and see whether that is declining or not. That's at the population level. But at the individual level, we have to motivate people to also check their risk factors. We need to empower people and motivate people to check. I mean, for instance, for COVID-19, you can't travel without doing your tests. And if you have any cough, you are compelled to do your tests, So it's something like that needs to be done so that people are really aware, really engaged and enthused about promoting and protecting their brain health. Because that's the best part of them, best part of everybody is the brain. And that is, I mean, because if someone has the entire body but cannot talk, cannot communicate, is almost like a vegetable. And that's why we say vegetative state. So that's the best part of our health and needs to be protected. And if people know what to do to protect and prevent deterioration, then they will do that.
Yes, I think that's wonderful. You have given that during COVID-19, everybody did travel with that, so they were all self-motivated to do that as well. Nobody need to have told that. It is the community who needs to be aware of it. So one last question, last but one, I should say. So we have this United Nations SDGs which are in place. So how does the IGAP sort of align with the United Nations SDGs, particularly which is related to the health and well-being? Would they go hand in hand or they would go separate?
They have to go hand in hand. We have to say that the key, and that was, I had a slide on that. I had a slide that put brain inside the SDGs. And, the point that we're making, and is in that publication, is that brain health is number one. Without brain health, it's not possible to have health. No brain health, no health. And without health, there is no wealth. SDG is impossible without health. So SDG 3 is so important that without it, every other thing fails. So SDG 3 maps into every other SDG. And in fact, if you want to solve problem, if you don't have brain health, how are you going to solve the problem at the level of government or any level at all? If there is no brain health and brain capital and brain economy. So it is impossible to achieve the SDGs without brain health and without health. And so they should work together.
Thank you so much. With your whole wealth of knowledge, expertise, and being a pioneer in the neurological revolution, would you want to give a message to our young clinicians, researchers who are here, and how they can contribute at their level for this ongoing neurological revolution?
Yeah. Thank you. Thank you so much. I really want to encourage you that you are the new generation. You are the future and also you are the present, so to speak. So you need to come up with innovative ways of tackling neurological conditions across the 4 pillars. What are the new ways, or how can we better do surveillance of neurological conditions? Can we come up with smart wristwatches or devices, or Internet of Things that helps us to map our risk of these conditions. I mean, we know smartwatches, for instance, can even be used to diagnose atrial fibrillation, can be used to assess whether you are sleeping or not sleeping, measure blood pressures and things like that, check how many steps you are taking, So can we come up with things like that that can help with neurological conditions? This is a challenge I'm throwing to the younger population and researchers so that we can have real-time data, on the body of neurological conditions. The second challenge is prevention. Can we come up with innovative social media video clips, skits, and new Indian movies, Indian film from Indian film industry, about how to prevent stroke, how to deal with stroke when it happens, how to deal with dementia, can we come up with those things that is educative and informative and entertaining? So they call it edutainment. Is entertaining, is educating. So edutainment. So that's important. So can we come up with such things that are powerful and that is also intersectoral, engaging the entire society to ensure that we are all able to protect our brain and come up with what can not only just protect our brain, but help us to perform at super levels. Almost everybody performing at super levels, which we call supermentia, being innovative, creative, and promoting and enhancing brain health. So we want that. So can you come up with such solutions in your research? Now, the other one is acute care. Can you come up with solutions whereby there are hotlines for neurological conditions and there are emergency healthcare delivery systems that make sure that anybody who has a stroke or any acute neurological condition gets the best of care? This may be through telemedicine, through disease support, decision tools, which may be AI powered and all of that. And then finally, rehabilitation is the least under researched, and we encourage many people to go into it. The field is crying for specialists and for therapists. So a lot of people need to go into it. And then can we then think about doing what many people may think is impossible? We know that neurological conditions are generally considered non-curable, and neurological deficits sometimes considered irreversible. But can we use the power of technology, brain-computer interfaces, spinal computer interfaces, stem cell therapy, synthetic biology? Can we use the power of all of these new technologies, innovations, and spiritual psychology to make people come back, to cure some of the incurables and make people still perform? In fact, perform better than before they had the neurological injuries? Like Rick who was able to transform the world after his spinal cord injury. The spinal cord
Yes.
injury almost became like a blessing in disguise. He has a foundation now, and that became a turning point in his life for good,
Yes.
even though it was meant to be for bad. So can we come up with such?
Yes.
That is the challenge I'm throwing to the generation.
Yes. So thank you so much. So I suppose it's innovation, use of technology, use of the entertainment media, and not just sitting at one surveillance, covering the whole spectrum from surveillance, prevention, treatment, rehabilitation, moving everything together. Thank you so much, Professor Mayawa, for that wonderful lecture, giving us your time. I, on behalf of Indian Academy of Neurology and the Outreach subsection, extend my sincere thanks for having joined us and enlightened us with your neurological revolution. And hopefully there were so many more researchers who would move forward with this whole spectrum which you have given in mind. Thank you once again.
Thank you so very much. Thank you. Have a wonderful day.
Thank you. Thank you so much. Bye-bye.
Thank you. Yeah.